Areas of focus for the radical retropubic prostatectomy. Description of the surgery. Reasons for the surgery. Approaches to take. Anesthetic use. Postoperative diagnostics. Nursing assessments. And discharge planning.
A radical retropubic prostatectomy is a surgical procedure performed to treat prostate cancer. The procedure involves the removal of the entire prostate gland, the seminal vesicles, as well as part of the bladder neck called the ampulla. In some cases, the lymph nodes and surrounding tissues may be removed and examined to determine if the cancer has spread beyond the prostate. The surgery is typically performed by a urologist, and the patient usually spends 2 to 3 days in the hospital, followed by a discharge home with a catheter for 2 to 3 weeks.
The reason this surgery is performed is to treat individuals who have early-stage prostate cancer confined to the prostate gland, or if prostate cancer has failed to respond to radiation therapy. The population that this surgery is generally performed on is older men who have a higher risk of developing prostate cancer, typically seen in men over the age of 65.
A postoperative diagnostic test used for the surgery is the prostate-specific antigen test, also known as PSA. This is required after the surgery to see how well the treatment worked and if the cancer will come back. PSA is only released by the prostate, so after the operation, the numbers and levels of PSA should be at 0 within 4 weeks of the surgery. If the levels come back greater than 0.2, it can indicate the cancer is returned, which is why this test is done every few months after the operation to ensure the levels remain low.
Discharge teaching. Rest at home is going to be crucial for 3 to 4 weeks after hospital discharge. The hospital will discharge you with a urinary catheter that will be removed within 1 to 3 weeks. Other possible factors at discharge could be the use of a Jackson Pratt drain, where you will be taught how to empty and care for this. For home wound care, the dressing will need to be changed once a day, if not sooner if it becomes soiled. The wound will need to be kept clean with the use of mild soap and water. The wound dressings can be removed when taking a shower only if sutures or glue were used to seal your skin. You do not want to use a bathtub for cleansing while the use of a catheter is in place. Upon removal of the catheter, your physician may approve these activities. You will not be permitted to drive for at least 3 weeks post-discharge from the hospital. No heavy lifting will be permitted for the first 6 weeks. Over time, you can generally build back to your normal exercise routine, but it will be very important not to overdo it. With the urinary catheter, your bladder will experience some spasms while the catheter is in place, and your physician may prescribe medications for this. The drainage in your catheter bag may be a darker color of red, and this is normal after this procedure. You will also need to know how to clean the tubing of the catheter and the area that is attached to your body so that infections can be avoided. After removal of the catheter, there may be blood in your urine, urinary incontinence, a burning sensation, and quite often an urgency to urinate. These are all normal feelings after the catheter has been removed. The use of Kegel exercises can help you strengthen your pelvic muscles, and you can perform these anytime while lying down or sitting. Other areas of teaching include drinking lots of water, eating fruits and vegetables, using stool softeners to prevent constipation. You may encounter sexual problems such as a lack of erection, lack of orgasm, or lack of semen during orgasm. These issues may take time to dissipate. You may want to note to check with your surgeon on the use of certain drugs that may cause blood clots in urine, such as aspirin, ibuprofen, and Aleve.